Hi, happy morning everyone. Welcome to Metier YouTube channel. I hope you're all fine and preparing well for upcoming NORCET as well as RRB exams. So we are posting important topics and important MCQs for the upcoming nursing competitive exams. So kindly subscribe our channel and utilize these videos for your preparations. So you all know that in NORCET 8 is going to come on April 12th. So that Metier has started a new batch, the NORCET batch for the exams. Okay. So the courses started on 16th of this December. So the last date for enrolling this batch is January 10. So kindly join as soon as possible so that you will update all the knowledges and you can cover all the subjects. Okay. Okay. Today we'll start the session with a small quote. Forget the mistake and remember the lesson. So whatever you've done the mistake in the previous exams, just forget about it. Remember what you have learned from those failed exams. That is very, very important. That will be helpful for your next upcoming exams. Okay. Forget the mistake. Remember the lesson. பழையசம் மறந்துருங்க. புதுசா அடுத்து என்ன பண்ண போலாங்கிறத அந்த கடைசியா விட்டிங் இல்ல அதுல இருந்து கத்துக்கோங்க. So அது உங்களுக்கு upcoming examக்கு helpful இருக்கும். Right? Yes, we'll start today's session. Today we are going to see about psychiatric medications. Very, very, very important. In all the exams, at least 1 or 2 psychiatric medications related questions will be there in all the nurse. Okay, so try to read the psychiatric medications and their side effects and the drugs interactions and the levels. That is very, very, very important. Okay. Okay. The first questions today's session. Which of the following is not a class of antidepressant? So the options they have given: heterocyclics, neuroleptics, serotonin specific agents, MAO inhibitors, monoamines oxidase inhibitors. So which of the following is not a class of antidepressants? The question is asking not a. That is very, very important. Always check for the keywords. Okay. Not a. So the correct option is option B, neuroleptics. Neuroleptics not a antidepressant. They are antipsychotics. Okay. Remaining option A, C, D. They are all coming under antidepressant classifications. Okay. If you have an antidepressant classification chart, the heterocyclics will be there, serotonin specific agents and the monoamines inhibitors, oxidase inhibitors will be there. They are coming under antidepressant. But these neuroleptics comes under antipsychotics. Examples: haloperidol, right? Risperidone, olanzapine, all those antipsychotics comes under neuroleptics. Now, neuroleptics where we will use mainly for the psychotic disorder like schizophrenia, right? Yes. So they are here not a class of antidepressant is neuroleptics. That is option B. Next question. Amitriptyline, amoxicillin, doxepin, and nortriptyline are examples of what class of medications? So all these medications comes under which class of medications? So the options: heterocyclics, neuroleptics, serotonin specific agents, MAO inhibitors. So the correct option is heterocyclics. See, except B, remaining A, C, D, all are comes under antidepressants only. But their mechanism of action is different. Okay. That's why they have classified. These all comes under antidepressant only. Except B, A, C, D comes under antidepressant. But their mechanism of action is different. Okay. Okay. This, according to this question, how the heterocyclics will act? They will act on the brain, especially the changes in the serotonin and norepinephrine level. So those are comes under heterocyclics. Okay. So the examples already given in the questions. Heterocyclics examples are amitriptyline, amoxicillin. Neuroleptics, we have seen the examples last questions. What about serotonin specific agents? What are the serotonin? Fluoxetine, escitalopram, those and all comes under serotonin specific agents. The question for you, the example of monoamino oxidase inhibitors, you have to type it in the chat box or the comment box. Okay, let me see. So that's all about this question. Question number 2 answer is option A, heterocyclics. Option 3, Question number 3. People taking an MAO inhibitor should avoid what? The options: loud noise, bright lights, social activities, citrus fruits, hot pepper, spices, over-exertion, sexual activity, heavy lifting, coffee, cheese, beans, and chocolate. So what will happen? The person who are taking monoamines oxidase inhibitor, they have to should avoid certain type of foods, beverages, and medications along with the MAO inhibitors. Why? Because the person who are taking MAO inhibitor, they are very dangerous for getting a hypertension crisis, that is increased blood pressure. Okay, so they have to avoid the foods, beverages which is contain tyramine. Tyramine and along with the MAO inhibitors combined to have the side effect of increased BP. So according to this question, option D, coffee, cheese, beans, and chocolate, they are containing tyramine. They're having the tyramine. So the person who is taking MAO inhibitor, they have to avoid option D, foods and beverages. Right? Yes. Next question. Question number 4. Obsessive compulsive disorder, OCD, or anxiety disorders and response best to what? So obsessive compulsive disorder, type of an anxiety disorder, right? So the question itself, you can understand, right? You can understand what medications will help for the obsessive compulsive disorder. The options: anti-anxiety medications, antidepressant medication, antipsychotic, anticonvulsant. So don't think that anxiety is there in the question. It's an anti-anxiety medications will help. No. The antidepressant medications are the first line treatment for the obsessive compulsive disorder. For example, fluoxetine, right? Yes. So antidepressant medications are very helpful for the obsessive compulsive disorder. It's a kind of an anxiety disorder characterized by what? Repetitive behaviors, thoughts leads to the obsessive compulsive disorder. So the psychiatrists will give the antidepressant medication. Anti-anxiety also helpful, but the best response is by the antidepressant medications. Okay, the anti-anxiety can be given, but that is second line. The first line is antidepressant. So the correct option is option B, right? Yes. So last question, very, very easy question, basic question. Psychiatric medications work by alter the way the brain produces, stores, and releases what? Hormones, neurotransmitters, blood components, neurostimulators. Easy. Anyone can answer. It is neurotransmitters. Why I have selected these questions? We will see all the detailed and very tough questions, but we forgot about the basic questions. So that is why I have taken this question. All the psychiatric illnesses mainly because of the changes in the brain, that is neurotransmitter changes. Okay, that's all about today's session. I hope the class was helpful. If you like the class, please press like button and share to your friends who are not joined and subscribe our channel. Okay, please utilize these classes and our coaching in the Metier Academy. So that will be helpful for you to crack the nursery competitive exams. Thank you all. Thank you so much. Meet you in the next session. நீங்க பழகிறது டெய்லியும் படிக்கிறது தான் உங்களை வந்து அடுத்த ப்ரோக்ரஸுக்கு கொண்டு போகும். ஸோ மோட்டிவேஷன் ஜஸ்ட் ஃபார் த யுவர் ஸ்டார்டிங், தட் இஸ் ஜஸ்ட் லைக் எ கீ, பட் யுவர் கண்டினியூட்டி, யுவர் ஹேபிட் இஸ் வாட் will make you success. Okay, so please make a habit of study daily, so that will be helpful for any nursing competitive exams. Okay, we'll start today's session. Today we are going to see about the image based questions. Okay, because in NORCET we will have the image based questions. So today we have prepared for the image based questions. Ready? Yes. First question. The procedure shown is associated with which disease? So they have given this picture. So what they are doing? They are removing some parasite, right? They are removing a parasite. Can you see it here? This is a parasite. So which is related to which disease? So the options: dragonculiasis, lymphatic filariasis, Madura foot, onchocerciasis. So the correct option is dragonculiasis. Okay, the correct answer is, one second. The correct answer is dragonculiasis. What is dragonculiasis? It's nothing but it is an guinea worm infestation. When the person drinking the contaminated water which is present with the larva, okay, that is mainly the guinea worm, what will happen? It will penetrate our stomach and it will grow in our stomach. Okay, the worm infestation will be present in the stomach. Then what happened? The female worm which is present in our stomach get migrated to the surface. I'll show the indicator so that it will be easy for you to understand. Okay. So see, first here, human drinks the unfiltered water which is present with the larva. That is mainly guinea worm. Usually these worms are ingested by the fish, frogs and other aquatic animals in the water. Usually it will be eaten by the frogs and everything. When the human drinking this contaminated water or uncooked fish, so what will happen? This larva will enter into our digestive system. So, okay. Then what happened? The larva, mainly the female larva, will migrate from the digestive system to the periphery, mainly to our foot. So that is why in this image you can see this is the female larva. Okay. So what is happening here? The physician is trying to remove the larva which is present in the periphery. Okay. So if you are not removing this larva, what will happen? Again, if you are keeping your foot in the water, this female larva will be enter into the water system. Again, it will get multiply. This is the cycle of this guinea worm infestation. It is called a dragonculiasis. Okay. So what is lymphatic filariasis? So this is the symbol of the lymphatic filariasis, right? Elephantiasis, whales call, no, Yanikal. Yes. What is this mother of foot? What is this mother of foot? It's nothing but it's a slow spreading skin infection. A small, hot, painless nodules will be there. Ulceration and pus discharge will be there. Discolorization, itching will be there. Why it is called mother of foot? You know, it is in early 1880s and all. This infection was detected in a district of Madurai, Tamil Nadu. So that is why it's called mother of foot. Okay. And we have seen the option called onchocerciasis, right? That is river blindness. When the parasite infection which is affecting the eye, okay, when the person is taking the bath in the contaminated river which is present with more parasite, it can lead to the blindness. That is called onchocerciasis. That is river blindness. Clear? So according to this image-based question, the answer is A. Clear? I hope you understand. So if you have any doubts, you can message in the comment box. Okay. Okay, next question. This image is indicative of which disease? So you can see the image. They have mentioned the cupping, splaying, fraying. Okay. Cupping, splaying and spraying. So all this which present in which disease? Options: osteomalacia, rickets, scurvy, skeletal fluorosis. So the correct answer is what? Yes, it is rickets. So the cupping, splaying, fraying, all will present this indicative of rickets. So nothing but when you take a child hand X-ray. So usually when the child is expective of nutritional rickets or any type of rickets, they will take a image of the child arm. So they can see the long bones growth, how the long bones are getting growth. So then they will diagnose whether it is a rickets or not. So what is that? What is meant by fraying, splaying and all? I'll show the picture. Yes. What is fraying? Fraying means nothing but indistinct margins of the metaphysis. So consider this is as a long bone. Okay, this is a long bone. Can you see it here, the black color marks? That is indicating a metaphysis are not having the proper margin. That is called fraying. Okay. just like a frying pan, right? That is fraying. Next is what is playing? Playing. Widening of the metaphyseal ends. Can you see? So U types, that is called splaying, the widening of the metaphyseal ends. Next is cupping. Nothing, cupping means it become like a cup, concavity of the metaphysis. That is called cupping. So these three, fraying, splaying, cupping, are seen in the rickets. Okay, that is the correct answer. Okay, next. In which of the following condition is this sign seen? Can you see it here? So what is this? Onchocerciasis, ophthalmic neonatal, trachoma, vitamin A deficiency. What is the correct option? The correct option is, yes, it is vitamin A deficiency. So what is this? It is bidot spot. Am I right? Yes, it is bidot spot seen in the vitamin A deficiency. So why it is happening? Why it is happening bidot spot? Bidot spot is nothing but it is a keratin which is normally will present in our superficial layer of the conjunctiva. When the vitamin A deficiency occur, it becomes irregular in shape and visibly we can see this bidot spot. It is related to the vitamin A deficiency, right? Yes. Next question. So this is the logo of what? Baby food, FSSAI certified food, organic food, vegetarian food. So what is this symbol indicating? It's easy, right? Many of you know that. Yes, it is organic food. Okay, it is organic food. So what is the symbol of baby food? So this is a symbol of baby food. One bowl with food and spoon. This is indicating of baby food. Many baby food containers, you can see this symbol. What is FSSAI symbol? So what is the abbreviation of FSSAI? Food Standard Safety Authority of India. That is FSSAI. This is a symbol of that. Okay. This is a symbol of vegetarian food. A green triangular with a green circle. Clear? Yes. So this is a logo of organic food. So last question today is identify the instrument. Many of the NORCET exams, definitely there will be one instrument will be there. Okay. So what is this instrument? Options: tissue holder, skin retractor, fascia cutter, stapler remover. So correct option is, it is stapler remover. Don't think that as a that stationary stapler remover. Okay, stapler, this is a surgical stapler remover. Sometimes in the exam, they won't give us a surgical stapler remover. Sometimes they will use a stapler remover. So this is stapler. This is a disposable stapler. This is a plastic one. I'll show the pointer so it'll be easy. Okay. So this is the stapler, which is, can you see it here? See, in place of sutures, they'll use the staplers. Okay. Nowadays, they are using gums also. Okay. So this is a disposable stapler remover. So this is the metallic one. Okay. So in the skin, it will be like this. After cutting, it will come like this. That is why it's before and after. Okay. So this is stapler remover. Okay. That's all about today's class. Thank you so much. I hope you understand that and the class was helpful for you. If you like the class, please press the like button. And if you have any doubts, please type it in the comment section. Thank you all. Thank you so much. See you in the next class.